come in.
Hello.
Hey.
Hi, James.
How are you?
I am doing well. How's it going?
Not too bad, not too bad.
How was your night?
It was good. I slept.
Good. We didn't wake you up too much?
Nah, not at all.
Perfect. Well, as we spoke about last night, I am here to complete your neurological examination.
Okay.
So today we have quite a few things to go over as far as sensory testing and neurological function.
Okay.
Probably mostly on your face. I'm slightly concerned about the delay in that eye, so I do want to do some pretty extensive sensory testing in your face, and this is going to help rule out any neurological dysfunction that might have happened during your accident, okay?
Sure.
So as we have the last few days, I'm going to do a repeat of a couple of questions just to see if you had any changes.
Okay.
So I'll go over a couple of things with you. Your vital signs were stable last night. I spoke with your on-unit night shift nurse, and she said that everything went well. There were no difficulties or any abnormalities there.
Good.
And your INO was all normal. Your food intake was good. Your appetite's still doing okay?
I think so.
Okay, good. All right, well, if I can just have you confirm your name for me.
Sure. James Monroe.
Perfect. And your age?
32 years old.
Very good. And obviously you're here because you were in a car accident.
Yeah.
So this is day 3, I believe, for you, correct?
Yes, it is.
Are you tolerating your food okay still?
Yes, I am. No more Jell-O.
As best as you can be, I guess.
Yes.
Okay. And did you have a bowel movement last night?
I did.
You did. Okay, perfect. So no issues with constipation or anything?
No.
Good. So I think we can go ahead and change your vital signs to Q8 for tonight. That way we're not waking you up every 4 hours. So they'll probably get the last set around 11 o'clock, and then we'll do it again around 6 o'clock in the morning, okay? So we'll skip that in between. Hopefully you'll be able to sleep throughout the night. We're not waking you up at 4 o'clock.
Okay, thank you.
All right, and you're doing okay walking to the restroom independently? No need for assistance at this point?
None. Not at all.
Perfect. Okay. I did let them remove the IV last night. We weren't using it, so you don't need IV access unless for whatever reason we have an emergency, then we would place a new one. But all of your medications at this point are discontinued except for the Tylenol, which you're taking PO by mouth, so we're okay with that.
All right, good.
All right, well, let's go ahead and get started with some of the questions.
Okay.
Can you tell me your current pain level?
1.
Any new discomfort anywhere?
No, no new discomfort.
Do you currently have a headache, or have you had a headache overnight?
No, I have not.
Any burning sensation anywhere?
No.
Any new numbness?
No.
Tingling?
No.
Any blurry vision?
No.
Double vision?
No, none.
No loss of vision?
No.
Okay. Any tinnitus or ringing of the ears overnight?
No.
No new hearing loss onset? No.
No, I don't think so.
Any loss of smell or odd smells?
Nope.
Loss of taste or odd taste?
No.
No metallic taste, correct?
No metallic taste.
Okay. And you said your appetite did well?
Yes.
Okay. All right. Well, do you have any questions before we get started?
No, I don't think so.
Okay. Well, let's go ahead and jump into it. We've got quite a few things to test.
Okay.
Some of it might be slightly uncomfortable and not painful, but I do need to get pretty up close to that eye, so we might experience a little bit of tearing, that kind of thing. None of it should be uncomfortable or like painful, okay?
Gotcha.
So I am going to get started by putting on a pair of gloves, and these are slightly different. I'm putting on sterile gloves today only because they fit a little tighter to the skin, and I don't want anything obstructing my ability to do the sensory testing. So in just a second while I put these on.
Sure.
She's a very vocal cat.
Yes. I think she wants to sit in my lap.
Okay, so let's go ahead and get started with the examination. I am going to start by having an initial look in that eye.
Okay.
So why don't I have you go ahead and remove your glasses,
Sure.
and I'll set them here just so we don't lose them.
Okay.
Okay. So I'll have you look just straight ahead for me. I just
Sure.
want to see if we're still having issues with that delay. I know it was a little better when we tested it yesterday compared to that first night. How did you do with your screen use yesterday? Did you notice any odd sensation upon using your phone or watching television, any burning or blurry vision or anything like that?
No.
No headache or like fullness or pressure behind your eyes at all?
No, but I didn't have too much screen time.
Just a little,
Just
how,
about
couple hours?
90 minutes maybe.
Okay, so not very long.
Yeah.
Okay. When I bring the light into your field of vision, is there any difference in sensation on either side? Like, is it more uncomfortable on this side here compared to this, or does it feel about the same?
I think it feels about the same.
About the same. So it's not like a pressure buildup here
No.
or here.
No.
Can I have you close your eyes? Open. Close. Open. Close. Open. Good. Okay. Okay, so I'm going to repeat that with a different light, and I have two more lights after this, so I just am kind of ruling out
Right.
any dysfunction with one color light versus another. So these are all slightly different,
Okay.
and I just want to see, it helps kind of mimic natural light, a light from an electronic and that kind of thing. So we're just kind of ruling out a bunch of different things. I do apologize for the noise outside. We've got some hospital construction going on out there, so you might hear some trucks going by.
Okay.
This one is a little dimmer, and this one is more so kind of stimulating blue light from like a computer screen or a phone. So, can you put your hand in front of your face about how far you would hold your cell phone?
About here.
Okay. And then look up. There you go. Okay. So let's do that again, and this one is more so stimulation of natural light, so like if you're outside. And you tilt your head up like you're catching a ball in the air. Good. And head down as if you're reaching for something on the ground. Okay, eyes closed and open and closed and open. One more time, closed and open. Good. Okay. Okay, so let's give you a break from the light for a minute. And I want to start with a bit of stimulus testing. So I have kind of a silicone filling brush here.
Okay.
I'm going to be brushing this over your eyebrows and your eyelashes, and I'm just looking for kind of a natural muscle response from your eyes, okay?
Okay.
So feel free to blink naturally. Good. So I am going to very, very gently brush over your eyelashes. So I'm just going to come a little bit closer here. I'll have you look up for me. Keep your head midline. Okay, blink a couple times. Do that again. Okay, so still getting just a tiny bit of an overreaction on this side.
Okay.
Okay. So let's see. A little tool here that's going to produce a puff of air. So I'm just going to blow this kind of directly into your eyes. So I'll have you just look ahead for me. Okay, close your eyes for me. Open. Close. Open. One more time. Close. Open. Okay. Definitely getting a delayed response with that on this side. Does that feel any different in like sensation here versus here? Can you feel the air the same on both sides, or is it less on this side?
I think I feel it more.
You feel it more on this
Yeah.
side. Interesting. Okay. Why don't we try kind of a double stimulus here? So let me use my light as well as a cotton bud. Have you look straight here for me. Do you feel that as I bring this in, you have a slight twitch in the bottom eyelid here?
Yes.
Definitely not on this side. Okay. So let's go ahead and move on to something slightly different. What I'm going to do is test your ability to sense something very, very soft. So this is just a soft cotton wisp. It's the same thing I was just using on your face. Can you feel that this is soft?
Yes.
Okay. So I'm going to have you close your eyes, and I want you to just say yes initially if you feel it, okay?
Okay. Yes. 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 Yes.
So let's do that again, this time with something a little more abrasive. Can you feel this?
Yes, I can.
Okay, it's the same thing. Say yes if you feel it.
Yes. 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 Yes.
And you can feel it here,
Yes.
kind of along the hair.
Mm-hmm.
Now I want you to tell me if you feel soft or sharp, okay?
Soft. Sharp. 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 Soft. 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 Sharp. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Sharp. Sharp.
Good, okay. So using this same tool, I'm going to wet one of them, and I want you to tell me if you feel that one is wet and one is dry. This might be a little bit difficult because it is a very small surface area, but in theory, you should be able to feel it.
Okay.
If nothing else, one will feel kind of colder than the other.
Right.
Just want to make sure that it's saturated. Okay. So close your eyes for me. I'm going to switch these around so you can't quite tell which one it is. And I want you to say cold. I want you to say wet or dry if you can tell the difference, okay?
Yes. Wet. Dry. Wet. 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 Dry. Dry. Wet. 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 Wet.
Very good. Okay. So I'm going to take a different tool. And this tool is cold, and I want to make sure that you're able to tell that this is wet and not just cold.
Okay.
So this here is wet,
Okay.
and that's cold. Can you
Okay.
tell that this is dry and cold and this is wet?
Yes, I believe so.
Okay. So I want you to say if it's cold or if it's wet.
Okay. Cold. Cold. Wet.
Good.
Cold. Wet. 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 Cold. 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 Wet.
Very good. Okay, so that is more of a difficult test, and you did very well with that. Okay. So why don't we do... Okay. So I am going to kind of push into various points just like this around your eyes.
Okay.
And I want you to just say yes if you feel it, okay?
Yes. 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 Yes.
Good. Very good. So I want you to take this tool and repeat in my hand what I'm putting in your hand. So close your eyes for me. Do it 3 times. Now I want you to take this and try to repeat that in my hand.
Sure.
Very good. Let's do that again. Eyes closed.
Mhm.
Okay. Okay, very close. So try that one again. Okay. Good, perfect. Okay. So I'm going to do that on the other side. I know it's a little difficult trying to mimic with your eyes closed. Okay. So this is going to be a very common letter. Okay. Very good. And I'll do that one more time. This time it's going to be a number. Thank you. Your best. Perfect. Can you tell me what number that is?
13.
Very good. Okay. Let's see if we can't bring her to come hang out with you.
Thank you.
All right, James, so I have two different kinds of brushes here, and obviously they're very different in texture and size. So this covers a much wider surface area.
Okay.
It's very soft silicone, and this is a kind of hard plastic. Can you tell the difference there?
Yes, I can.
Okay. So let's call this 1 and this 2,
Okay.
and I want you to be able to tell me if you feel 2 or 1
Okay.
on your face. Okay.
Yep.
So eyes closed for me.
2. 2. 1. 1. 2. 2. 1. 1. 2. 2. 2. 1. 1. 1. 1.
Very good. Now eyes open. You don't have to tell me if you can feel it this time. So still getting that kind of oversensitivity on this side. So I have a little silicone tool here.
Okay.
I'm just going to place this over my finger. Keep your eyes open for me.
All right.
So I'll have you look here. And actually, let me go ahead and do that with the light just to make it a little easier for you to have something to focus on. So just look at the light here. Okay, eyes closed and open. Okay. Okay, so let's move on to something slightly different. I want you to close your eyes for me.
Okay.
Tell me what this smells like.
Oranges.
Good. And now?
Lemon.
Good. And last one.
Tea bag.
Very good, it's tea tree.
Okay.
Okay, so keeping that in mind, I want you to keep your eyes closed. Tell me what this is. You did good.
I'm not sure.
Very good.
almost lemon again.
Okay. Let's try this one.
Citrus, but I'm not sure.
Okay, it's the orange. Good.
Okay.
So now what I'm going to do is have you stick out your tongue for me. Tell me what that is.
Salty water.
What does this smell like?
Orange. Lemon.
Let's try that again. Smell.
I can't tell.
Okay. So stick your tongue out for me one more time. And what does that taste like?
Salty.
Big deep breath in. What does it smell like?
Not tea.
Not tea.
I'm not sure.
Okay, one more time.
It's sweet.
You've smelled it before.
Lemongrass.
Very good.
Okay.
Okay. So that's a little mind trick for you. The salt water on your palate kind of shifts your your ability to smell.
Yeah.
So it does confuse you a little bit, and because the smells are very, very similar,
Yes.
it makes it a little more difficult, but you did very well.
Thank you.
Okay. Let's move on here. I want to try creating a little bit of a grid if I can. So I want you to keep your eyes open, and does this here feel the same as this?
Yes, I believe it does.
Okay, and if we do here and here,
Yes.
okay, here, here, here all feels the same.
Yes.
Very gently on your eyelid here, and here's the same.
Yes.
Underneath is the same.
Feels more sharp the first time.
This side,
Yes.
more sharp here versus here.
Correct.
Okay, that's what I suspected. So I want you to tell me all of this feels the same.
Yes.
Does all of this feel the same, or is it sharper at any point?
It's sharper once it gets to about the middle of my eye.
Okay, so tell me, I'm gonna start. I want you to tell me to stop when it feels sharper.
Right there.
Okay. And we'll do that coming from the other side. So tell me to stop when it feels sharper.
Right there.
Good. Now I'm going to come up from the bottom. Same thing.
Just right at the very end.
Okay. So about here.
Yes.
Okay. So I am just going to kind of define that a little bit. Okay. And if you close your eyes for me, is it sharper here as well, or bottom lid only?
I believe bottom only.
Okay.
That wasn't bad at all.
Okay. So I'm just going to measure that area. Just give me 1 second. It's about a 1.5 inch section there that you're having that little bit of hypersensitivity.
Okay.
And it is right parallel, kind of midline to the pupil, which tells me that there might be some very, very slight pupillary dysfunction there, which is why we're getting that overreaction and the excess tear production. So what I'm going to do now is produce a very, very distinct simuli with this tool. So this is sterile. I'm going to pop the top here so you can see that this is a clean needle.
Okay.
It's very sharp. It's going to be a very gentle test. I don't need to worry. I'm not going to puncture the skin. So can you feel this here?
Yes.
Can you feel that that's very sharp?
Yes.
Okay. You feel that this side is not?
Correct.
Okay. So you can keep your eyes open. I want you to tell me 10 out of 10, how sharp is that?
1.
In here.
1.
In here.
1, 2.
2. In here.
1.
In here.
1.
And here.
1.
Look up for me. Here.
About a 2.
Same here.
Yes.
Same here and here. Dull.
Yes, dull.
Feels the same on both sides.
Yes, it does.
Okay. And any point is that sharper?
Yeah, the third tap you made was the sharpest.
I apologize.
That's okay.
And here.
She says sharp.
Is that sharper at any point there?
Maybe the third one again.
Okay, so equally as sharp in the middle there.
Yes.
Good. Okay. So I'm just gonna put this in my sharp container here. I don't want to poke anyone else's cat.
That's okay.
Okay. All right, so what we're gonna do now is a little bit of a different kind of light examination. So I'm gonna start with this not occluding. So we're really focusing on the eye that is open. The other eye will be covered just for the purposes of the exam, but
Okay.
focusing on this eye. Is it all right if I kind of lean on you
Sure,
here?
it's fine.
Can you see through this hole?
A little bit.
Okay.
If you put it a little bit lower, I can maybe see better.
Here?
Yes.
Perfect. Can you see the light?
Yes, I can.
Okay. Follow the light with your eye only. Okay. Now keep your head and eye midline. Don't follow the light. Okay. Tell me if you can see that.
Yes, I can.
Good. Follow the light. No, don't follow. Perfect. Okay. So you should kind of barely be able to see the light here.
Right.
Okay. So don't follow it. Open wide. Good. Okay. So let's do that again. Don't follow. Good. Okay. So I'm going to do some various tapping, and you don't have to tell me whether or not you can feel it. Just checking for regular reflex check, so you should feel just a light tap, okay?
Yes.
Just doing the same thing with a little bit of a bigger hammer here, so
Okay.
just focus. Close your eyes for me. Okay, go ahead and open. She feels left out. Okay, so I'm going to use the other side of this hammer here, and it's a very cold sensation.
Okay.
Can you tell me if this feels any different than here?
No, it doesn't.
Same.
Okay.
Same here and here.
Yes.
Here and here.
Yes.
Here and here.
Yes.
And then here and here is the same.
Yes, it is.
Okay. Okay, so we have a different tool here. It's going to produce a very light kind of humming vibration. Can you feel this?
Yes.
Do you feel the vibration or just a pressure?
Mostly the pressure.
Can you feel the vibration at all?
A little bit.
Okay.
Very slightly.
You feel vibration or pressure?
Vibration.
More so than this side?
About the same now.
Good. Okay. Same thing. Close your eyes for me. Tell me vibration or pressure.
Pressure. Vibration. Vibration. Pressure.
Good. Eyes open for me. Does that feel equal on both sides?
Yes, it does.
Equal on both sides?
Yes.
Okay. So I've kind of a cold globe here. I want you to tell me if at any point this feels any different. Does that feel the same all the way around?
Yeah, it feels the same.
Okay, close your eyes for me. Is that the same here and here?
Yes.
Good. Now I have a different kind of tool here. This might be slightly uncomfortable. Tell me if this feels the same all the way around.
Yes, it does.
And here.
Yes.
And over the eye, same.
Yep.
Open your eyes for me. I'm gonna get very, very close here. I apologize. I'm just looking for any twitch in the eyelid. I'm going to attach a different tool head here, and this is called an ophthalmoscope. If I can get it to cooperate with me. There we go. Okay. So I'm going to be having a look in your eye while I use these tweezers to manipulate your skin. Just look straight ahead for me. Look up, look up. Good. This just allows me to look underneath the lower lid. Very good. Now I am going to switch back to my otoscope. Okay. I have two lights.
Okay.
And I want you to look at this one only.
Okay.
Okay. Perfect. Now I want you to look at this one only.
Okay.
Blink for me. Okay. Okay. So give me just 1 second here. I am going to catch up on a couple notes.
Okay.
Okay. So what I am going to do now is testing some neurological functions. I want you to stick out this hand for me. We can leave that one since this is more so the affected side and you're also holding your cat. So eyes straight ahead for me.
Mhm.
Don't pay attention to what I'm doing.
Okay.
So I'm gonna turn your hand towards here. Keep looking straight ahead. Doing great. Okay, flip back over for me. So the test we did earlier where I had you repeat it, I'm gonna do the same thing here. You can keep your eyes open, just keep looking straight ahead.
Okay.
This time it's gonna be 3 different ones, okay? So
Mhm.
this is 1, 2, 2. This is 3. Want me to repeat it one more time?
Yes, please.
1, 2, 3. So it's
Okay.
a series of consecutive 3, either letters or numbers.
I only got the first two.
Okay.
I got like a V and a Z. I don't know what the second one. Maybe a T for the second one. I'm not
Okay.
sure.
So this is 1,
Okay.
2,
Okay.
3.
Okay. I think X.
Good.
I think Y.
Good.
I think Z.
Good job. Okay. So you wear these glasses full time, correct?
Yes, I do.
Let's go ahead and put these on. I apologize, I'm not great at this part.
It's okay. You missed my left there. Mm.
Better?
No.
No?
Thank you.
Better there.
You push them up if you don't mind. Thank you.
There you go. Okay. So let's try. Have you look at the light here. Can you see these fingers?
Yes.
Can you tell me how many they are?
2,
Here,
4,
here,
5,
here,
2,
here,
5,
here.
3, 1,
See that?
2, 3, 5, 1, 2,
Good. Okay. Good job. Alright, so I would like, let's see. I'm gonna listen to your eye.
Okay.
Just trying to determine whether or not this is an obstruction issue or a sensory issue. So you can just relax for me.
Okay.
Okay. So I want you to breathe in deep, puff your cheeks out, and hold your breath. So go ahead. Good. Okay. So it's definitely not an issue with any kind of occlusion. There's no blood flow that's lacking anywhere. So this is definitely a very, very slight neurological dysfunction with one of your cranial nerves. I'm gonna have you look at this Acuity chart for me.
Sure.
Tell me what that letter is.
Letter E, L, T, F, P, H, O, L, C, F.
Good. Now I want you to close one eye.
Mm-hmm.
You see this?
Yes.
Keep it closed.
Mm-hmm.
Can you still see that?
Yes.
Open. Are you able to close the other eye?
Yes.
Can you see this?
Yes.
You see it as I move it around?
Yes, I can.
Tell me what letter that is.
Letter H.
How close can you see that? When does it become blurry?
Right about there.
And how far away? If you can still see it now, that's fine.
Yes, I can.
Okay. So let's do that with the other eye. Can you see this?
Yes, I can.
What letter is that?
D.
Tell me when it becomes blurry.
All right. Blurry.
Good. Okay. All right. You trace a couple things with your hand for me.
Okay.
Give you this. Trace that number to the best of your ability. And one more. Tell me what those two numbers are.
35 and 96.
Good. And here?
Number 2.
Do you see any number here?
No, there's no number.
Here?
45.
Here?
Number 7.
Here?
74.
What number is this?
2.
Here?
9.
Here?
8. 5.
And here.
12.
Good. Okay. So I am going to hold this keyboard
Okay.
close enough to where you can type.
Okay.
I want you to spell your first name,
Sure.
last name. Can you see these numbers here?
Yes.
Type out your date of birth, 2 digits, 2 digits, 4 digits. can you write, I am a patient? Okay. Testing some coordination and just basic ability to read and write. You did very well with that. You're doing very well.
Thank
Do
you.
you need a break? We are almost done.
Nah, we can finish up.
Okay. Just checking some stuff off here. Okay. Can you see this sentence here?
Yes.
Can you read it out loud for me?
Sure. They heard him speak on the radio last night.
Good. What does this say?
Baseball player. Huckleberry. Thanks. 50-50. Tip top.
I want you to read this one in letters.
Sure. M-A-M-A.
And what does that say?
Mama.
Good. Now I want you to look at this picture and follow it as I move it around.
Okay.
You see it clearly everywhere. Keep your head straight.
Sure.
You still see it here?
No. Yes. 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 No.
Good. Okay. I'm going to bring it in really close. Tell me when this person's face gets blurry.
All right. Blurry.
And clear.
Clear.
Good. Okay. I am going to revisit just a couple things here. Stick your tongue out for me. Does that taste like anything?
No, just water.
Okay. Okay. What does this smell like?
Orange.
Good. What does that smell like?
Tea again.
Good. And what does that smell like?
Lemon.
Again?
Lemon.
Again?
Tea.
Good. Okay. Very good. I was trying to trick you, but you did very well.
Thanks.
Just double checking on that cranial nerve there and make sure that's not related to the sensitivity in your eye. Okay. So, essentially my conclusion is that your ocular nerve was slightly damaged in the car accident.
Okay.
If I had to guess, it's not a major deficit in any way, but there is a little bit of that oversensitivity.
Right.
I would hope that it would kind of clear up on its own. It might just be that there was a little bit of a deviation or that there's some edema going on in the ocular nerve itself. So if you have some swelling, it might just be creating a very microscopic kind of dissolution in the flow, which is preventing you from being able to either feel things as much as you should.
Right.
In this case, you're feeling them more so than you should.
Yeah.
I hope that it does clear up over time. The only way to really rule out any kind of deeper diagnosis would be to do an MRI. At this point, I don't really think we need to do that because
Okay.
none of your other cranial nerves are affected.
Right.
Your neurological functions, aside from the sensory component, seem to be intact.
Okay.
I don't think it's necessary for us to do an MRI at this point unless you really want one, just to see if there could be anything major going on. But from a medical standpoint, I don't find it necessary at this point.
Right. Yeah, I understand.
Okay. I would say that we can probably go ahead and discharge you tomorrow.
Okay, good.
Every other examination that we've done up until this point has been okay. You have stable vital signs, you're tolerating food well, your intake and output has been abundant, there's no issues there. So you no longer have the residual headache or anything like that. Pupillary dilation is normal, which was my major concern because the first day it was slightly off. So I would say we can go ahead and discharge you tomorrow. I would like you to follow up with a neurologist in about 6 weeks so they
Okay.
can do some of these tests in office.
Right.
If there are still some deficits happening, then at that point they would probably recommend we go ahead and do an MRI just to make sure that there's no permanent damage done to your optic nerve, okay?
Okay, that sounds good.
All right, so we will keep you overnight. Vital signs will be done 8 hours.
Okay.
Q 8 hours there. We still have the Tylenol ordered for you should you need it. So
Okay.
tomorrow morning I will come in, do a very brief follow-up examination, make sure everything is still functioning well, and then we'll probably let you go.
Okay.
Okay.
Awesome.
If you need a referral to that neurologist, I can give you one tomorrow morning on your way out, okay?
All right. Thank you.
Perfect. Well, thank you so much, James. I hope you have a good night.
Thank you.
Let us know if you need anything. And
All
I will
right.
see you first thing in the morning.
All right. Hope it's my last night. Thank
I
you.
hope so too.